Hello everyone. In our lecture series about drugs acting on respiratory system, today we'll talk about antihistamines. Antihistamines are defined as drugs that block the action of histamine at H1 receptors, thereby preventing many of the symptoms produced during allergic reactions. Histamine is a chemical mediator released mainly from the mast cells and basophils during allergic responses. It causes vasodilation, increased capillary permeability, itching, sneezing, and bronchoconstriction. By blocking H1 receptors, antihistamines reduce these allergic symptoms. Now, antihistamines are broadly classified into two: first generation antihistamines and second generation antihistamines. First generation antihistamines readily cross the blood brain barrier and therefore produce significant sedation. Examples include Diphenhydramine, Promethazine, Chlorpheniramine, Hydroxyzine, and Dimenhydrinate. Second generation antihistamines have minimal penetration into the brain and are therefore called non-sedating or less sedating antihistamines. Examples include Cetirizine, Levocetirizine, Fexofenadine, etc. Among these, Fexofenadine and Bilastine are considered amongst the least sedating antihistamines. Now let's understand how antihistamines actually work. When our body is exposed to an allergen such as pollen, dust, or certain foods, the immune system activates mast cells and basophils which release histamine. Histamine then binds to H1 receptors present on blood vessels, sensory nerve endings, and smooth muscles. Activation of these receptors produces the typical features of an allergic reaction like swelling, itching, sneezing, and running nose. Now, when antihistamines are administered, they work by occupying these H1 receptors before histamine can bind to them. Actually, H1 receptors are inverse agonists, meaning they stabilize the receptor in its inactive state rather than simply blocking it. As a result, the effects of histamine are greatly reduced. There is less vasodilation, less leakage of fluid from capillaries, reduced itching, decreased sneezing, less nasal discharge, and relief from redness and swelling. It is important to remember that antihistamines do not stop mast cells from releasing histamine. They only prevent histamine from producing its effects after it has been released. This is why they work best when taken early in an allergic reaction or before anticipated allergen exposure, such as before the pollen season or before unavoidable exposure to known allergens. Another important point is that histamine is only one of the several chemical mediators involved in allergic inflammation. Mediators such as leukotrienes, prostaglandins, and cytokines also contribute to inflammatory response. Therefore, antihistamines are very effective in conditions like allergic rhinitis, urticaria, and allergic conjunctivitis, but they have only limited role in diseases like bronchial asthma where multiple inflammatory mediators are involved. Antihistamines are commonly used in allergic rhinitis, allergic conjunctivitis, urticaria, pruritus or itching, drug allergies, insect bite reactions, etc. Some first generation antihistamines have additional uses because of their central nervous system effects. For example, Promethazine is used for motion sickness and has a preoperative sedative effect. Dimenhydrinate is effective in motion sickness and vertigo. Diphenhydramine may be used as a short-term sleep aid and also in drug-induced Parkinsonism because of its anticholinergic properties. The side effects depend largely on generation of antihistamine. First generation antihistamine commonly cause drowsiness, sedation, dizziness, impaired concentration, dry mouth, blurred vision, constipation, and urinary retention. These anticholinergic effects are especially troublesome in elderly patients. Patients should be advised to avoid driving or operating heavy machinery after taking sedating antihistamines. Alcohol and other CNS depressants can further increase sedation. Second generation antihistamines are much safer regarding central nervous system effects. Occasionally, they may cause mild headache, dry mouth, fatigue, or nausea. Overall, they are preferred for long-term treatment because they interfere much less with daily activities. So, some important points about antihistamines are: first generation antihistamines cross the blood-brain barrier and cause sedation. Second generation antihistamines are preferred because they are less sedating. Antihistamines are effective in allergic conditions but have limited benefit in bronchial asthma, where leukotrienes and other inflammatory mediators play a major role. They are most effective when taken early, before histamine has produced its full effects. Fexofenadine and Bilastine are among the least sedating H1 antihistamines. Promethazine and Dimenhydrinate are excellent drugs for motion sickness because of their antihistaminic and anticholinergic actions. So, to summarize, antihistamines are H1 receptor blockers used mainly to treat allergic disorders. They are classified into first generation sedating drugs and second generation non-sedating drugs. They work by blocking the action of histamine, thereby relieving itching, sneezing, swelling, and other allergic symptoms. Second generation antihistamines are generally preferred because they are more selective and produce fewer side effects. So, this was all about antihistamines. See you in the next video. Thank you.